Next up, we've got Jillian Hetherman
No.
presenting Gynaìka? Gynaìka.
Close.
Okay,
I can say
Gynaìka.
it. Yeah.
Sorry.
Hi everyone, I'm Jillian Hetherman and today I am presenting to you Gynaìka. So we're going to start with a video.
Gynaìka is an innovative solution to the way women's healthcare is administered and approached by providers in the United States. Nearly every woman has a story regarding her experience with medical malpractice, invalidation, or dismissal. I personally experienced this dark reality when I turned 18 and noticed a shift in the level of care I received from my doctors. Within 1 week, I had gone to 3 different doctors in 3 different specialties and experienced the same set of problems. I was forgotten about in the exam room. I was told I may have developed chronic conditions such as endometriosis and PCOS. I was prescribed medications that might help, and I remained undiagnosed. Unfortunately, I am not alone. Thousands of other women have experienced the same uncertainty, confusion, and dismissal regarding their health. This is where the game is changing. This is where Gynaìka comes in. Gynaìka is changing the outdated system of the past and replacing it with a direct provider-to-patient approach that prioritizes the care of patients as well as the provider's ability to effectively do their job. When providers adopt the Gynaìka approach and curriculum, their ability to correctly and compassionately care for their patients is prioritized over adhering to third-party policies. The Gynaìka approach ensures that patients and providers close the power gap between them by empowering patients to take control of their health, remain informed during their appointments, and understand medical language and processes. At Gynaìka, we believe your healthcare journey is a collaboration, and we want you to lead us through it.
So this is Gynaìka, and I feel like it's important to start with the name. So the name is actually woman in Greek, and that's because this is a female-centric approach to women's healthcare. Now, for our business model, our product is a written program that requires providers to apply specific offerings or practices by the medical professionals in their institutions. So this also brings implementation options because we understand that we have to work with the existing systems in place rather than work around them or try and overhaul them. And with that, we're developing a training course so that providers who are working in these clinics with this new approach understand how to correctly and compassionately care for patients in this specific way. Some of the offerings include offering a variety of speculum sizes, offering a different level of mammogram awareness, such as like 3D printing mammogram awareness, which is very confusing, by the way, but it's very cool. It's a less painful way of doing mammograms, which I'm sure everyone would love. It also is emphasizing preventative care because we believe that preventing what chronic conditions a lot of women do develop is honestly like the first and foremost of healthcare. In addition to that, we believe that closing the power dynamic is really important. So by having practitioner consistency during, before, and after your appointments is going to create that foundation for a relationship that you feel really supports you in your healthcare journey. Now for our unique value proposition, because we are a patient-centric approach, we know that this is going to bring in satisfied patients to institutions that adopt this approach, which means that those institutions will have better ratings. And this is also going to allow their medical professionals to have preparation in dealing with patients compassionately. And now also insurance companies are going to want to support these institutions that adopt the Gynaìka approach because it's been proven that if there's another way to do something, if patients like that way better, then they will be transitioning to that new clinic because they don't want to stay in a place that they don't feel supports their healthcare journey. And insurance companies want to keep that business. So our go-to-market strategy is to first have the program written and developed by medical professionals, medical writers, and curriculum writers in tandem with one another. And in doing so, we're going to have a patient and provider advisory board to kind of oversee the process because who better to give input and feedback than the people that it's going to affect, first and foremost. It's also going to be tested on female subjects by licensed practitioners when trials start to commence. And then we also are going to hope for university and academic collaboration to see how the research kind of supports the development of these different programs. So how we're going to generate revenue? Well, it's a nonprofit, which means that we need to find funding with donations and philanthropy, and this also can go in tandem with medical grants, as well as government grants and academic grants, if we get that academic collaboration aspect. And also, if we find clinics to collaborate with us, hopefully they have funding set aside to adopt this new approach. So that could also be another way to garner funding. Our timeline. So it's going to take about 6 months to write the first set of the program, which includes the training and the implementation options, as well as the program itself. And then going into the first trial with the advisory board consulting, we're going to revise that and then do another trial, and then a hopeful partnership with institutions such as Harvard Medical, Mass General Brigham, and then Ariande Labs, which is basically doing the same thing, rewriting the approach to healthcare, but on a more broad spectrum. So it would be great to have them oversee everything. And then furthering that with another in-house trial, revising that trial, doing it again, and then training practitioners for the final implementation. And then hopefully the long-term goal is to build up the Gynaìka Women's Health Center, which allows us to just implement it from the get-go instead of having to work around pre-existing systems. So our budget allocation, we're asking for around $500,000, and that's because medical business is like no joke. You really can't cut corners with cost. So that's going to go to fees for the professionals and their expertise. And then we're also going to have some marketing fees, but that's not really for the general public, so we kind of allocated that further down. So in order to measure success, we're going to ask 3 questions. How many clinics have implemented Gynaìka? How many patients has Gynaìka reached and impacted positively? And then how many people, practitioners, students, schools, patients, have reached out wanting to use this program and take part of it? And that is how we're going to measure success. So thank you. This has been Gynaìka, an innovative approach to women's healthcare.
I feel like I could be sitting in a hospital boardroom right now and have someone, presenting a new program that they're coming up with. It's really amazing.
Thank you. Thank you.
Let's start with Bhamathi this time.
This is a tough one because it's fabulous and I love the idea and I absolutely commend your coming up with it. And I agree with you. Spot on the analysis of the market and the situation, and you've obviously dug really deep into understanding how to build it out. So kudos on all that, because it's a really, you probably bit off the hardest space to be in, right? Because medical care is it's a morass, right? So Yeah, right, yeah. So full disclosure, my sister-in-law is a neuroscientist and she teaches in a medical school in New York, and she does training for doctors and for people going into medical professions, and she's also a scientist. And it's a tough one, right? They very much want to do what your model is doing, but there's a lot of resistance at a lot of points. I suspect that the hardest lift for you will be that initial breaking down the skepticism and saying, not just, it's very easy to see where your value add is, but what you're implicitly, or maybe not so implicitly saying is, we've critiqued what's there and it's lacking in these very, important ways, right? Fundamentally not serving women. That's not a message that the medical establishment is super keen on hearing. So I like the messaging that you've done so much, and I like the way that you focused really on sort of building it out over time, because I think what you're implicitly saying is we need to build trust in us. And I think that's your lift. Building trust in you, your product. You've got a metric fuck ton, I believe is the technical term, of regulations that you are going to have to clear. I know one of these days I'm going to get fired from Emerson for my dirty mouth, but as Sharon always likes to point out, I'm a New Yorker. I'm a New Yorker. We do that, right? It's in our DNA. So don't we? Yeah. Tim does not, however. He is far too gracious and far too much of a gentleman, but the rest of us mere mortals do. Okay. So what I think you have to do is you really do have to make it clear that you have checked all those HIPAA boxes and medical boxes and all the other regulations around healthcare. But more to the point, you really need to get the buy-in of the medical professional world. The people who are training doctors, the medical schools, you need to do some outreach to med schools, I think. You need to do some outreach to insurance companies and say, we are not threatening your business model. I want to tell you right now, I would love to see multiple size speculums. That's a purely selfish point of view, and there will be no more TMI.
They have them.
Well,
you just have to ask for them.
I know, but guess why? Guess what? everything in the medical world is costs. I mean, everything in the world is costs and benefits. Everything in the world is costs and benefits, as I must tell my students 80 billion times a day. But I'm telling you right now that in medical school, that is to the power of n. So think about the costs of that stuff and pick your battles. I think 3D mammogram printing is a great idea in theory, and it has not been tested out enough, and it hasn't jumped through the hurdles. And as you probably know, you've got to make sure that it's got all the clearances, not just of the, the usual governing bodies, right? But it's the tests of the trials of that stuff, years and years and years, right? So I love your idea. I love the fact that you have a very, I think, realistic pricing and timeline, and you've thought it through intensely and well. But I would say, like, it's a tough, you've bitten off a lot. Total kudos on your ambition and on your vision. So,
but we know that it is doable because we heard from the executive director of Ariadne Labs, who Jillian is now connected with, and she will make it happen.
Yes.
Fantastic. I will
Amy,
invest in that. I will invest.
I know it's odd for me to ask a man his opinion, but your background in human-centric design here is so important. So I'd love to hear from Amy and from Buck on this.
I'll go, Buck, give you a chance to catch up. So I'll kind of echo what Bomedy said. When Eisenhower said, beware of the great industrial complex, that has nothing military complex on what the medical complex is like. It is so ingrained in our society to trust doctors, and they all know best. And as you know, client feedback, customer patient feedback isn't necessarily what they're looking for. So kudos to you for taking on this challenge, because it definitely needs to be done. One area that you might want to consider going after is there's a slew of offshore medical schools. In the United States, there aren't enough medical schools for all the applicants that we have. And unless you get the top score, you don't get into the US medical schools. So there's a whole group of offshore medical schools, and they are looking for ways to distinguish themselves to prospective students. So if you can get some of those schools to start adopting these practices, it will help brand them. And then, of course, those physicians are now in the marketplace, and they'll start bringing these ideas to fruition for you. Just so you know, the residency programs are all funded by the United States. I forget the department, what it is, but that's why there's offshore medical schools exist, because we can't fill all the residency programs in the United States. So going to them with this idea might help help you launch, but also give them a way to distinguish themselves from these other schools. And what works there will certainly work in other medical schools. The other idea is, I think we talked about this way back when the program started, but try to influence the Press Ganey surveys. Those are the surveys that are given out to the medical establishment to rate their services. And if you could have a section, just a couple questions on the Press Ganey survey that talk about this, again, you're influencing the entire institutions, globally. So yes, great kudos to you for taking this on. It's definitely needed. Keep going with your passion, but you do have to have a long timeline and how long it's going to take to actually implement this. Sorry, but true.
No, it's true.
Amy.
Thank you.
Thank you.
Buck.
Okay, this is fantastic, and also, thank you for calling on me, Sharon. I think that women's health is a black box to most men, and having men understand the concerns that you're raising here is really important. So I wouldn't leave guys out of this when you look at who you're outreaching to. I really appreciate the focus that you've brought to this. You talked about that moment turning 18, maybe it's turning 26, when women are starting to manage their own health, their own doctors, their own insurance. And I think that is a moment when, I can certainly empathize with that personally, that you have to get up to speed pretty quickly. And so I think there is an angle around education there, and I like your not-for-profit angle. One small tweak, I think, on something that's not quite working yet is the name. People have tripped over it just on this call a couple of times, and I love the origin of your name, but maybe there's a twist on that. So maybe there's something that you can use that word as your jumping off point, and then make sure it's really easy for people to say and to share and to shout, because you're going to have to shout. I think, as both panelists have brought up, this is the hardest space to fix, and it's also the most broken and most worthwhile. My architecture professor used to tell me before reviews, go fast and wear a helmet. You're going to need one, because there are so many reasons why innovation and change in healthcare can't work, and people are going to tell you all of them. Collect all of those reasons and use it to, build your ramp over this wall, because it's worth solving, and go for it.
Thank you. That was great feedback.
Thank you so much, everyone. Thank you, Jillian.